Welcome to Dental Bites, a way to get to know who we are by what we do. I'm Shannon D'Angelo, Dr. Giordano's former assistant and current office manager. Our topic for this Dental Bite? Implants. Okay, so you're missing a tooth or teeth, and you're now faced with that decision of how shall I fill that space? You may have been given some options, for instance, like leaving the space, doing a partial, doing a denture, maybe a fixed bridge, a crown, or maybe even an implant. So let's look at what it means to actually have an implant. The beauty of doing an implant is that it will act as a natural tooth, except it'll never decay. Some people will use an implant whether they have one tooth to do or several teeth to be done. In fact, those people who have been wearing dentures, full dentures for many years, will often have several implants placed and then the denture actually placed over that to hold it in place and keep everything really secure. This is how it works. First, a post is placed into the bone. Then the tissue is allowed to heal over that post for up to 6 months. It is then uncovered and a healing cap is placed on top of the post. The dentist then takes an image or impression to make an abutment, which is the piece that attaches to the post and is above the gums. And then the crown fits over the abutment. The process is complete when the dentist inserts and cements the abutment and the crown. This technology has been around for more than 40 years and is changing very quickly. For instance, sometimes the healing cap can be placed immediately following the post placement and with no waiting. We can now also take an image with our CEREC machine and send it directly to the lab so that no impression is necessary. So you're probably wondering who does all of these procedures. Well, it's actually Dr. Giordano's preference that an oral surgeon or a periodontist actually do the surgical portion of this, which is to place that post into the bone. However, dentists are able to do that as well. What you would do once the surgery is completed is come back to Dr. Giordano, and he would actually make and insert the abutment and the crown. Implants are a great choice for tooth replacement. And the best part? They never decay.